Hello and welcome to your Ultrasound month. This video will serve as a short introduction to the ultrasound rotation. This is an excellent opportunity to build upon your ultrasound skills that you will be using throughout your residency and your career to enhance patient care. We ask that you make the most of your time while scanning patients in the emergency department, as ultrasound is a skill that takes repetition and practice. We also ask that you utilize your ultrasound faculty for any needs. The remainder of the video will serve as a general orientation and expectations for the ultrasound month. On the rotation, you will be paired with another resident. This will either be a first or third year emergency medicine resident. You should have received a syllabus for your specific year of training. We ask that you review this and follow it closely. You will also be borrowed a copy of Ma Matier's emergency ultrasound textbook. Please return the copy at the end of the month. You should also have received a calendar given your ultrasound obligations as well as your clinical shifts. If you happen to have been scheduled simultaneously for an ultrasound activity and a clinical shift, please prioritize your clinical shifts. Third year residents should also receive a pager which will alert them of all trauma calls and alerts in the department. There are 4 main components to your ultrasound month. This includes scanning in the department, attending quality assurance sessions, independent learning, which you will be assigned, and finally a short presentation, which will be a journal club led by the first year resident or a grand rounds led by a third year resident at a later date. When you are ultrasounding patients in the department, you will at times be scanning independently, with a co-resident on the rotation, or an ultrasound dedicated faculty member. We will ideally pair you up as much as possible with one of our ultrasound faculty members. However, all of our ED staff should be facile in basic core ultrasound applications and should be used as a resource. When you arrive to the department on your scanning shift, please notify all attending providers and resident doctors that you are available to perform ultrasounds. Please attempt to attend or perform all ultrasound guided procedures in the department as well, unless another resident is going to perform it. Also make yourself available via Vocera so you can be reached when a scan is indicated. Ultrasounds performed in our department fall into 2 main categories. These are both clinical and educational scans. Clinical scans are performed as part of the patient's care and will go into their chart. Educational scans are ultrasounds that are performed mostly for learning purposes and teaching purposes. These do not end up in the chart. When a clinically indicated scan is performed, you should be able to pull in the patient's information via the work list in the bottom right-hand corner. The information should then populate on this Patient tab. Where it says User, please enter your name and be consistent so we can identify your scans. When an educational scan is performed, all you have to enter is both the user and also write EDU under the MRN tab. After performing a clinically indicated scan, please notify the providers caring for the patient of your findings. If you are uncertain of your findings, make them aware of that and repeat the scan with your provider or one of the ED ultrasound faculty members if present. If you perform an educational scan but find pathology or have concerning findings that is unknown to the patient or the care team, please notify your faculty member as well. After each clinically indicated scan, you should place your read into the reading work list and send it to the physician to sign and review. If a procedure was performed along with the ultrasound, a separate procedure note should be placed in the patient's chart, just as you typically would when you are taking care of the patient clinically. A preliminary read should be placed on all patients who had an ultrasound performed before they leave the department. This is imperative for patient quality and is also used by our admitting teams to help with patient care. In order to get the most out of this month, you need to be an active and aggressive adult learner and seek out as many patients as you can. We ask that you attend all trauma calls and alerts. For all trauma alerts, please record the EFAST exam under the placeholder DOE attached to that patient. The DOE placeholder name should automatically be listed under the patient's work list on the ultrasound machine. If not, quickly enter their information so the images can be attached to the patient's chart. In addition to trauma patients, we ask that you prioritize patients with high acuity. These are often patients in our trauma bay or rooms A through D, and all patients with abnormal vital signs. These are the patients that could benefit the most from our bedside ultrasounds. Do your best to integrate ultrasound early into the patient's care, as this can impact their management. Serial ultrasounds can often be indicated in these patients, and as a first-year resident, you should take advantage of working closely with your senior residents and learn from them in these high acuity situations. Another area to emphasize during this month should be performing ultrasound-guided procedures. You should prioritize ultrasound-guided IVs, as this is a critical skill. Notify your nurses that you are seeking out these procedures and attempt to perform them early in the patient's stay. This is also a good time to work on things such as ultrasound-guided central lines or other more novel or technical ultrasound-guided procedures. This month is a good time to read about and also perfect these skills. Interns should take advantage of being paired with a more senior resident, as they can help teach and assist in these procedures, along with faculty members. When there are no clinically indicated scans pending or procedures to be performed, please seek out educational scans. Seek out patients with known or interesting pathology. These are often patients who already had formal imaging performed in the department, such as a CT scan or an ultrasound performed by our technicians. This is a good time to test your skills and correlate with what you are seeing on your own imaging with the formal imaging. Let patients know that these are educational scans and make sure you receive their permission before you perform them. During the month, you should also attempt to observe several formal radiology scans performed by our ED sonographers, who are located near our X-ray technicians. Attempt to observe scans such as DVT ultrasounds, pelvic ultrasounds, or even formal wide upper quadrants, or anything that you find interesting. When you are not working clinically, you are also to attend quality assurance sessions on Tuesday mornings. These are dedicated sessions where we review scans performed by our clinicians in the department. Please keep track of scans that you perform that you would like to review at this session as well. This is also a time to discuss core ultrasound topics and review material that you are interested or need practice in. Please reference your syllabus for the required online modules on EM Sono and also the reading in Ma Ematir's emergency ultrasound textbook. By having you complete this independently, this allows for maximal hands-on training time and quality assurance sessions with you. Hopefully the ultrasound rotation has inspired you to learn a little bit more about a particular topic. Each EM1 on the rotation will present a journal club. On the first QA of the month, please present an article that you want to present to the group. On the last QA of the month that you will be able to attend, we ask that you present a short journal club to the group. This is informal and should be about 10 to 15 minutes. You may present the journal club in any format you wish. You may also present something such as a podcast or an online learning tool or module that you came across on your ultrasound rotation. Each EM3 will present a Grand Rounds lecture with another EM3 classmate. The date will be given at a later time. Each topic should be approved by one of the ultrasound faculty members. Feel free to teach or review a basic or core ultrasound technique used in emergency medicine. You may also present literature on core ultrasound topics, or even bring up new or novel techniques. We hope this will be a relaxing yet an impactful month for you. Dedicate your time to scanning while you're in the department and take the time to get your assignments and reading done. This is the time to learn core ultrasound skills which will carry you throughout your clinical career. Please utilize your ultrasound faculty and the numerous online resources that are out there.